Okay, first I would walk in, shut the door for privacy, and sanitize my hands. Hi, my name is Olivia. I'm going to be your primary nurse today. Would you mind telling me your name and date of birth?
Maya, March 5th, 2004.
Perfect. So today I heard you're in for a respiratory exam.
Yes.
Have you had any history of respiratory issues?
No.
Any family history of respiratory issues?
No.
Okay, awesome. So we'll get started. First, we're going to go through with inspection. So I would examine the overall color of your skin, as well as the lips and the fingers for pallor or cyanosis or just any abnormalities in general. And then I would not tell the patient I would be doing this at the same time, but I would count their respirations for a span of 30 seconds. So I'll start that now, and again, that would be without the patient knowing. And as I do this, I would continue to inspect the overall skin. Okay, so the patient's respirations were a 14 for a full minute, so she had 7 in 30 seconds, and multiply that by 2 because her breathing rate was normal, regular, and easy, so didn't have to do the full minute, so 14 breaths per minute. And now we would look at a full respiration from the front and the back to check for symmetry. So if you give one deep breath in for me, and exhale. Perfect. And then we go to the back. Breathe in for me, and breathe out. And as we're looking at this, of course, we would continue to check for any skin abnormalities, or any just extra, like, breath sounds such as wheezing. So one more breath in, and exhale. And one more breath in, and exhale. Perfect. So her breathing, the chest expands symmetrically on the front and the back. So the next stage of the exam is palpation. So first I am going to just overall palpate the chest and the back for any lumps, bumps, tenderness, or pain. So we're going to start on the front. I'm going to put my hands on. I would have washed my hands before this. So we're just going to examine. And let me know if you're feeling any pain. Are you feeling okay?
Yes.
I know it tickles, but just keep it going. You're doing good. Okay. One more time just to double check. Perfect. No abnormalities on the front. Now we'll check the back. We'll start up all the way by the top of the apices of the lungs. And just go all the way down. And we always have to remember to check laterally and under the axilla as well. Perfect. Everything's normal there. And next we will check for, once again, symmetric chest expansion. So I'm going to place my hands over her chest, and she's going to inhale and exhale. And one more time. Inhale. Exhale. And I can feel my hands moving evenly together up and down, which is good. And then on the back, we will check for the same symmetry. So I'll place my hands right underneath T10 with my thumb squeezing in a bit. And I'm going to have you breathe in and exhale and in and exhale. And I can feel my thumbs moving up and down evenly, which is another good thing. And finally, we'll test for tactile fremetus, which is the vibration that happens during low frequency vocalization. So I'm just gonna move my hands over the various landmarks of the chest and the back as the patient repeats the word 99 in each position, just to check for any abnormal vibrations or sounds underneath. Okay, so as I place my hands in the areas, you're gonna say 99.
99. 99.
And we always check side to side to compare, and we'll move laterally and down the chest cavity.
99. 99. 99. 99.
Perfect. Everything's normal. And then we will go to the back for the same purpose. And I'm going to have you repeat the same thing.
99. 99. 99.
And again, moving laterally and down to compare side to side. And we'll start once again at about the apices of the lungs.
99. 99. 99. 99. 99.
And we always remember to go laterally and under the axilla.
99. 99. 99. 99. 99. 99.
Perfect. Everything is good there. Okay, so the next step is percussion, and for that we're just going to be using one of my fingers as a bass and the other to kind of tap down on, and we're going to move it across 6 regions over the anterior chest cavity and 8 regions over the posterior chest cavity. And this percussion technique is just used to test for any changes in resonance across the lung fields and the chest cavity. So we'll get started. Place that here. And we're going to start on the front. Just one finger. And I'm going to have you lie down for the next portion. I'm going to lift your shirt up a little bit if that's okay. And we're going to go underneath. Perfect, and you can sit back up. And now we're going to go to the posterior portion. So for this, once again, we'll start by the apices of the lungs and laterally and down, just like I did on the front, because you want to compare side to side the resonance as you move, laterally and down the chest cavity. So 6 areas on the front and 8 areas on the back. And we always remember to go laterally and under the axilla as well. Perfect. And once again, for a woman or even a male with a very muscular chest, you may have to kind of shift to the breast tissue in order to get better access to percuss. And yeah, that's it. Okay, so finally we are at auscultation, which is the last part of the exam. And here we're just going to be listening to the lungs and seeing if we hear any adventitious breath sounds such as wheezing or crackling. And we'll also be listening to the neck and the chest. The neck will be listening to bronchial sounds, and then we'll move down to the top of the chest for bronchovesicular sounds, and then to a bit lower for vesicular sounds. So bronchial, bronchovesicular, and vesicular sounds are all normal breath sounds. And like I said, crackles, wheezes, or any other adventitious sounds are things that we would need to further examine. So we'll get started. And again, we'll have the 6 areas on the anterior chest and the 8 areas on the posterior chest. So we're going to start up here. I'm going to have you inhale, exhale, 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 and inhale, exhale. And during this type of test, you would want to make sure before to tell the patient if they're getting lightheaded at all, to just let you know and take a break, which is very common with geriatric patients. Just all of the deep breathing can cause some lightheadedness or dizziness, so it's important to let the patient know. Are you feeling okay?
Yes.
Okay. So we're doing the 8 regions on the back now. And moving laterally and down like we have been this whole time. So starting at the apices of the lungs. Inhale, exhale, 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 inhale, exhale. And we'll go laterally and to the axilla. So inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Perfect. So everything was sounding normal. course, if I were to hear any crackles or wheezes or any other extra breath sounds, we would further look into that. But otherwise, thank you so much for your time. Have a great day.
You too.
And also, for video purposes, we had her keep her shirt on, but otherwise for like the percussion tests or using the stethoscope, it would definitely be more practical to have her in a sports bra, just to eliminate any of those extraneous sounds. But yeah, for video purposes, I let her keep her shirt on. So yeah.